We're taking care of our bodies. Millions suffer from joint pain due to injuries and osteoarthritis. Conventional treatments include injections, pain medications, or surgery. In advanced cases, joint replacement surgery may be required with downtime and loss of mobility. With so much at stake, Dr. David Greuner, a leading vascular surgeon, developed the no-knife procedure. This technique literally starves injured or diseased areas of oxygen, resulting in rapid pain relief with no downtime. And it's all done through a small needle point entry. So Dr. Greuner joins us now to share the details. So how does osteoarthritis develop and cause pain in the knee, shoulder, and other joints? Let's understand this first.
Arthritis is basically a overuse injury. So I see two types of patients. The vast majority are athletes because they're demanding a lot of their body. And they're also, most athletes have osteoarthritis at around 30 because they're essentially driving their body at 10,000 RPM.
Yes, I can attest to that. My knees hurt a lot.
Yeah, but do you run?
Yes, I used to be an avid runner, and I try not to do it so much anymore.
Well, you know who to come to.
So this no-knife procedure, how is it performed and how does it work to relieve pain?
Basically, the common theme is everything in the body requires blood, oxygen. You can get rid of anything in the body, good or bad, by cutting off the blood supply to it. So what we do is we selectively, and this works for tumors, it works for fibroids, it works for all kinds of things, prostate. Basically, you go and you find the new vessels that are going to the area of concern. In the knee, it would be in the knee or shoulder or hip, it would be new vessels, or what's called neovascularization, going to the arthritis. And basically, you selectively block off those, leaving the normal arteries intact, and the patient literally feels better just while they're on the table.
This seems revolutionary because I've known people who have had to have surgery for things like this, and they're down for a while. So can the procedure restore full mobility? Can you get total control and total movement of those joints after this procedure?
Absolutely. You have to take into consideration a few other things, meaning you have to talk to the patient and find out whether, things like ligamentous instability will cause your joint to bang a little harder against each other than other things. So a lot of the athletes I see, they have joint instability, and when they're they basically, instead of their joint just gliding on itself like it should, it bounces on itself and smashes the bone. So if they do have, after you treat the arthritis, you don't want it to recur. So if they have ligamentous instability, which you would detect by exam, what you can use is PRP or prolotherapy, and that tightens up the ligaments very well.
Okay, so you mentioned there you treat many pro athletes and athletes. How does sports medicine compare to treating everyday patients? Would you use this procedure on both types of patients?
Absolutely. In pro athletes, I did one of the UFC heavyweight champs this year, and he went to 7 orthopedists, and his only option was shoulder replacement, he was told. And these are, quality guys. It's a fairly new procedure, so not a lot of people know about it. But I was able to go in, this is a childhood friend of mine. I was able to go in and block off the arthritis for him, and he was better immediately. No physical therapy, no recovery. They have a little bit of soreness sometimes, depending on what you're doing. But in general, they're literally night and day from when they go into the operating room to out.
Well, in my experience, sometimes doctors like the way they practice, and that's how they practice medicine, and they don't like to try or do new things. So I'm always looking for doctors like you who have these cutting edge procedures that can cut down on, you know, the downtime, and it can be less invasive. It seems like, especially for an athlete, it seems like that would be the path that they would want to go down on. Okay, Dr. Greuner, thank you so much for being here. We have your website up there, and we'll have more information about this no knife procedure on our website as well. Thank you so much.
Thank you so much for having me.